My name is Andrea Bontrager Yoder. I'm a registered dietitian nutritionist and a certified intuitive eating counselor. I work at Beacon Medical Group Pediatrics, Bristol Street in Elkhart. One of the challenges that I see patients for is picky eating. Picky eating can make feeding children really stressful for the parents and for the children. When I see a patient and their family, I like to introduce them first to the idea of the division of responsibility. The division of responsibility is a framework around feeding and eating that was developed by Ellen Satter, a registered dietitian and family therapist. In the division of responsibility, the parent decides what foods are offered, when meals and snacks are offered, and where eating happens. And the child decides whether to eat and how much. In terms of what is offered, it's important that the parent provides a safe food. Now, safe food is something that the child generally likes and accepts, but not necessarily the food that the child feels like eating at that particular moment in time. The goal is for the parent to make just one meal or just one snack that everyone in the home can eat at least part of. Another important part of the division of responsibility framework is to offer foods at regular, predictable intervals and to avoid allowing children to graze. Grazing makes it so that kids don't ever experience even a comfortable level of hunger. A comfortable level of hunger can help some children and adults be more receptive to trying new foods. For toddlers and preschoolers, regular meals and snacks might mean offering a snack or a meal every 2 to 3 hours. Older children can usually stretch to 4 hours or so. Now, for the children's responsibilities, I said that the parents need to allow the child to decide whether to eat as well as how much to eat. This helps children tune into their own hunger and fullness signals. Those signals are as natural as knowing when you need to go to the bathroom. Beyond the division of responsibility, here are a few tips to keep in mind. Children should always have fruits and vegetables as part of their meals and snacks. The recommended intake is 5 to 9 servings daily, but a serving size is dependent on the size and the age of the child. Instead of worrying about a certain amount to get each day, offer fruits and vegetables with each meal and snack, and work to offer a variety of fruits and vegetables over the course of a week or two. If your child is picky enough that they don't yet enjoy vegetables, focus on offering more fruits. And if your child for some reason doesn't enjoy fruits, but they like vegetables, focus on offering the vegetables. Another tip for improving the nutrition of a picky eater is thinking about milk and dairy products. These include things like cheese, yogurt, kefir, as well as fluid milk. These are nutrient-rich foods that are important to children's growth and development. Third tip that I'll offer is that children should be offered as much as possible a variety of foods from each of the 5 food groups. The 5 food groups include fruits, vegetables, grains, dairy products, and protein foods. This helps make sure they obtain a wide variety of nutrients. The more restricted a child's intake, the more likely they are to develop nutritional deficiencies. Now, sometimes picky eating can happen from a wide variety of origins. It could be because they are sort of a super taster, which means that they experience the different flavors at a really, really intense level. And so something that's a little bitter to you or me might be really unfathomably bitter to them. Some children have difficulty with a wide variety of textures, or children can also have problems with the mechanics of chewing and swallowing. And if that is the case, that's best diagnosed and treated with the help of a speech-language pathologist. If your child is a selective eater and you suspect that they are just developmentally picky, because some kids really just are, consider asking your pediatrician or family physician for a referral to a registered dietitian nutritionist who can work with your family to take steps toward enjoying a wider variety of foods. To find a provider near you, visit beaconhealthsystem.org.